Coming up on News for Brockport, the coronavirus rages on, how this is affecting medical professionals as they try to help as many as possible, and how Wegmans is trying to keep people safe while staying in stock. News for Brockport starts now. The team you can count on to keep you up to date. This is News for Brockport First at 5. Welcome, ladies and gentlemen. Tonight, we continue to follow up on the coronavirus updates. Here's Nate Munt with our first story.
As the number of confirmed coronavirus cases continues to rise in New York, many hospitals are starting to run low on necessary supplies. Governor Andrew Cuomo expects hospitals will need about 40,000 ventilators once the number of coronavirus cases peak. New York currently has about 12,000 ventilators. Hospitals are also running low on masks to protect nurses and doctors. The shortage is making it more difficult for nurses like Lisa Salongo to do their jobs.
The stress level in the hospital at the current time is very high. Everything changes hour by hour. We get updates frequently of all the changes.
Hospitals are short on more than just supplies. The number of available intensive care unit beds is dwindling.
Why are the ICU beds important? Because the people who come in, vulnerable populations, older people, underlying illnesses, respiratory problems, they need the ICU bed. They need the ventilators. They need the machines that breathe for them.
Governor Cuomo is making hospitals increase their bed capacity by at least 50%. All unnecessary surgeries have been canceled or rescheduled to make more room for COVID patients. President Trump said that much-needed supplies are on their way to New York.
2.4 million face shields, 1.9 million surgical gowns, 13.5 million gloves, and more than 4,000 ventilators to the areas of greatest need have already been sent, and we have 4,000 being delivered to New York.
However, some nurses think the government should have been more prepared.
And the shortage with the government, highly disappointed in my government.
Despite all these shortages, the governor wants New Yorkers to stay strong.
This is a moment that is going to change this nation. This is a moment that forges character, forges people, changes people, make them stronger.
Nate Munt, Brockport News for you.
Businesses across the country are feeling the impact of the coronavirus. While many businesses have closed temporarily or have had to lay off workers, essential businesses in the area have had to find new ways to operate while also practicing social distancing. The Walworth Animal Hospital is one such business. Instead of coming inside, clients have to wait inside their cars while their pets are looked at without them. The animal hospital has also changed its operating hours and is only seeing emergency cases. Veterinarian Dr. Vanessa Bernhardt has never dealt with anything quite like this before.
We have had to go to seeing our veterinary appointments curbside, basically. We go into the parking lot, get the pet, and talk to the owners over the phone or go to the car. It's been very different. We are no longer seeing anything that isn't sick or like an emergency basis, which is definitely unusual. Had to kind of expand as far as the length of time that we're seeing patients and really cut back on our surgeries.
Those that stay in business during this pandemic will have to continue to find new ways of working. From Walworth, New York, I'm Connor Zerniak.
In February, where people are like, oh, it's in our country now, and I'm still like, that's not that bad. And then, boom, next month, I hear that it's in my school, and that just makes me think, boy, does it spread fast.
Canandaigua Middle School had one of the first recorded COVID-19 cases in an area school. CMS was forced to close, and James says keeping up with schoolwork in an online-only format has been difficult.
It's hard not having the teacher right in front of you in class, so when you don't understand something, you can't ask in person. That's been a pain.
Like many middle schoolers, James passes the time by gaming online with his buddies. He says that's not necessarily a bad thing.
Keeping in touch with my friends that way is actually more fun than in school. Because in school, you have to do schoolwork, be quiet, so you can't really talk to your friends. I feel like this one's more fun.
There's still no word on when school buildings will be back open to students. Despite the added free time, James is pretty clear on what he'd like to see.
I'd definitely rather be in school.
Joe Lasky, Brockport News for you.
As area businesses close to comply with social distancing orders, grocery stores like Wegmans are taking steps to support necessary shopping that keeps their customers and employees safe. The Rochester-based company has closed its Market Cafe seating areas and has placed limits on how many customers are allowed in the stores. Because of a need to sanitize their stores, Wegmans locations in upstate New York have reduced their operating hours to 7 a.m. through 10 p.m. This gives the grocery store chain a chance to thoroughly sanitize and stock their stores. The company states, "As part of our everyday practices, we follow strict food safety policies and procedures above and beyond what is required of us to ensure a safe environment for all. We continue to reinforce employee education regarding viral prevention and encouraging them to stay home when they don't feel well. Still, we are taking additional measures to help ensure the health and safety of our employees and customers. These additional measures include plexiglass shields on registers, enhanced sanitation practices, and even masks for employees. The company intends to keep its stores open with food on the shelf, and it appears to be fulfilling that promise, no matter the store." Kyle Boyd, Brockport News.
Coming up next, we find out how one restaurant tries to adapt to having less customers.
Governor Cuomo's order forcing restaurants to do takeout orders only has made it difficult for employers to keep working staff. Because of COVID-19, restaurants have seen less business than usual. Some restaurants can only afford to keep half their staff working at one time. Marcus Grombols, the owner of Mark's Texas Hots, is keeping their restaurant half-staffed 24 hours a day, 7 days a week.
And if we can pay the people to work here, if I close, I make no money anyways. But if I just stay open and pay, half my stuff, they make some money because these guys, they need money every week. And nobody, to leave too. So far, it's okay.
In response, President Trump signed the Paycheck Protection Program into law to help small businesses pay their employees. The $349 billion program gave small businesses forgivable loans. However, funding is already low. President Trump's response is to add an additional $250 billion to replenish the program.
Phase 1 was $350 billion, and now phase 2, we want to do $250 billion. This goes to workers, and it goes to small businesses so we can save all the small businesses around our nation.
Despite the financial struggle for many local restaurants, safety is a main priority for employers. Rachel Dickinson, a local chef, says many restaurants adopt a unique approach.
From what I can see, they're doing no contact pickups and deliveries, and I think that's a really smart idea. Some people think it's extreme, but I would rather be safer or as safe as possible. So I think those businesses are the smartest, in my opinion.
Restaurants will have to continue with low staff employees and rely on takeout orders to keep their businesses from closing. Reporting from Rochester, Maricruz Reyes, Brockport News for you.
Finger Lakes Radio Group, a small group of stations in the Finger Lakes region, is trying to cope with the dizzying pace of news with somewhat limited resources.
We're going to talk about the feeding program that you've undertaken, in addition to what you had already been doing anyway. But in the meantime, just tell us the status of the clubs and the community center and what you guys are all doing to cope.
Program director and morning show host Ted Baker says plenty has changed, but the core mission is the same.
We're hearing some very good things, and we appreciate that. Our website traffic is up considerably because we put some COVID resources up pretty early. For us, really in News Talk Radio, we're not doing anything differently than what we always do. It's ramped up a bit, and it's maybe a bit more urgent, but this is kind of what we do, and we're just taking it to the next level, trying to find all the different angles.
Coronavirus has forced the company to lay off some of their employees, but Baker says they're still working as hard as ever.
We have we've had some layoffs here at the Finger Lakes Radio Group. I'm sure that's not unique to any advertising media. So some of us are going to have to double up and do a little bit more, hopefully for a short period of time until we get back to normal.
Baker says it's been tough, but the crisis has allowed the station's advisors to have a little fun reimagining what radio should be right now.
It's a bigger change, I think, for the people in the music stations, like I said, than it is for us. They're becoming much more interested in news and information now because everybody wants that. But they also want their entertainment. So on the music side, we've been doing some fun things, bringing back requests. And, on the wall, they're going to do a whole hour of metal, I think, maybe today or this weekend. I mean, so, we're all trying to figure out that angle that we can take to give people what they want.
Joe Lasky, Brockport News for you.
Don't leave your package in plain sight.
Tourist hotspots now turn to ghost towns. Orlando area theme parks like Disney, Universal, and SeaWorld are closed until further notice in an effort to enforce social distancing as COVID-19 infections spread throughout the world. Christian Johnston is a ride operator at Universal Studios, where he says the pause on tourism has been dramatic.
Roads are dead.
Yeah.
I drive a very big tourist street. It's empty. All the lights are off. So it's absolutely dead. Universal Boulevard, right where a lot of, our parking structures are, where you see City Walk, usually that road is beyond packed. Usually takes you a good 20 minutes just to get through there. It's dead. Nothing's going on.
Despite being furloughed, Johnson says that Universal Parks, owned by NBC Comcast, has been open and honest with park associates, and they have worked to meet their needs when possible.
They're constantly keeping us updated. Weekly venues have Zoom meetings just to kind of give updates on the park. Universal's offering, help in order to fill out, unemployment applications. So Universal has been beyond phenomenal with all they can do to help.
Florida theme parks closed on Sunday, March 15th and will remain closed until further notice. One thing that is certain is that when parks begin to open up, whenever that may be, capacity and accommodations will be limited. Johnson says that he has already heard about how Universal intends to operate upon reopening.
A lot of rides are going to implement a lot of disinfecting procedures. A lot of rides are getting rid of the single rider line. We're trying to keep, families with their families. We're considering, putting tape throughout our queue to keep people at least 6 feet apart. Loading every other row just so they're not as close to each other. And after a certain amount of rides, disinfecting the ride vehicles just to keep them as clean as possible.
As the country battles to contain the spread of COVID-19, once bustling tourist destinations have had to take a pause. For parks like Disney, this has been the longest closing since the park opened in 1971. Theme parks will present a significant challenge in maintaining social distance guidelines from the CDC. In due time, I'm sure the parks will return to their normal operating schedule once given the all clear. For now, videos from the past will have to suffice. For News 4 in Brockport, I'm Kyle Boyd.
As the number of New York coronavirus cases began to rise in mid-March, Governor Andrew Cuomo issued an executive order that closed all New York State schools until further notice. Since then, teachers have transitioned their normally face-to-face classes to an online format. Though this is uncharted territory for many K-12 educators, middle school art teacher Maggie Feierabend is finding new and creative ways to keep her students engaged.
It's quite an adaptation. In my art room, typically, I am running around getting materials out. It's very hands-on. The kids come in and we sit down and I have either a rolling art project that they're working on, or I'm introducing something new. And I always have used technology anyway to, reinforce what concepts I'm trying, or, always having the directions posted up on the smart board. But this is totally different because I'm behind my computer, putting directions out through Google slideshows in Google Classroom on my computer to their computer. And the materials were very limited. I don't know what they have in their homes. So I have to be even
a little bit more creative, coming up with ideas that still stick with my curriculum. I do a daily art challenge. The kids made these little tubes. It's like a little optical illusion. And they decorated them, and we talked about Zentangle. So that's just one of the Padlets that the kids can post their work on. Yeah, we are totally just kind of rolling with it. It's we're hanging in there. That's what we're doing. But I still feel like we're getting some pretty quality instruction still.
So though online schooling has its challenges, this new situation has paved the way for teachers to be more creative in how they help their students learn. Reporting from home, Marty Feierabend.
After the break, find out how the coronavirus has changed the life of a radiation therapist. Of course, people throughout the world have been greatly affected by the coronavirus pandemic. Most people have been laid off and are not working. But there are still some people that are still able to go to work every day. That includes Michael Martinek, who works for a private clinic in Syracuse.
While I'm not directly involved in caring for patients who have already contracted the coronavirus, I'm certainly side by side along my patients, and they're going through a lot of the same fears as if they were to have had it.
For the past month, Michael and his coworkers have had to adjust to the changes that are going on in the world every day. Unfortunately, some of his peers have not been too fortunate when it comes to their job security.
We actually had to furlough quite a bit of employees. I believe the number is right around 30% of the workforce has been furloughed. So for one, that means everyone else who still is there needs to be extra vigilant to make sure that all the T's are crossed and the I's are dotted. We all need to chip in and do extra work that we're not used to doing, or that would not normally fall under the purview of our particular role in the office.
Not only have some of Michael's peers been furloughed, but he himself has seen a reduction in hours.
My hours have actually also been reduced a little bit. We've been able to find some ways to squeeze things together a little bit more than we normally would, so that the same patient load can be handled but in a slightly less period of time. Honestly, it's not the ideal way to do it. There's a little bit less person-to-person interaction.
But there are some positives in Michael having his hours reduced, as life at home has actually improved for him.
Me living in Rochester and working in Syracuse, having my hours reduced slightly has been very favorable at home. I have a chance to relax a little more, get everything done around the house. I've been able to do hobbies that I've been putting aside for the last couple of years, just mainly because I now have a little more time to do that.
As far as what the future holds for people, Michael believes that it will be a while until the coronavirus can be defeated.
We're not going to get rid of this thing until we have a vaccine. You listen to the news, they say maybe 12 months at the very, very best. Most people are hoping that it gets done in 18 months. But the previous record for how quickly a vaccine has come together is 4 years from the time it started until there was an actual vaccine that was approved. That was for measles decades and decades ago. While with those viruses, there wasn't the same sort of focus where you have so many different companies and agencies working together to try to combat something.
Michael also mentioned that he believes that we will always be thinking about the coronavirus, but hopes that at the very least this pandemic will teach people to take better care of themselves and be better with their personal hygiene in public. Well, that's all the time we have for here on Brockport News for You. We hope you learned more about how the coronavirus is impacting everyone. Stay indoors as much as possible and social distance when outside.